Have you heard the recent news that the American Heart Association supports low-carb and very low-carb diets for reducing cardiovascular risk in people with type 2 diabetes? Well, it's partially true. I think we have to be careful about how overexcited or how we overinterpret their inclusion of low-carb diets in their latest update on treatment of cardiovascular risk in people with type 2 diabetes. Let's get into the details. I'm Dr. Brett Scher, the medical director at dietdoctor.com. And look, just the fact that the American Heart Association is acknowledging benefits of low carb and very low carb diets is pretty remarkable because in the past, it seems like the cardiology community, especially large cardiology groups, have been very opposed to low carb diets and strictly promote low fat diets and Mediterranean style diets and not much else. So just the fact that it's being talked about in a guide and an update called The Comprehensive Management of Cardiovascular Risk Factors for Adults with Type 2 Diabetes, a scientific statement from the American Heart Association. So it's an update to their scientific statement. So just the fact that they mention it is pretty groundbreaking, but they definitely don't, overwhelmingly recommend it or say it's one of the better diets. And again, if you look at the amount of time or the amount of space allocated to diet versus the amount of space allocated to drugs and medications, it is dramatically different. Well, so let's talk about some of the specifics here. First, one important part is they talk about lifestyle management in general. They talk about the Look Ahead trial, which was one of the biggest and most intensive trials looking specifically at lifestyle modification. So a low fat, eat less, move more kind of approach, and the eventual outcome, not just on hemoglobin A1C and blood sugar control, but on cardiovascular outcomes. And what they found in all comers, there was no difference in cardiovascular outcome. Despite A1C improvements, despite weight loss, there was no difference in cardiovascular outcomes. Now, when they specifically look at the group that lost more than 10% of their body weight, then in that group, there was a reduction in cardiovascular outcomes. But I think it tells you something that the old message of low fat, eat less, move more may not be working for the outcomes that we really want, which is improving people's lives and reducing the risk of heart attacks and strokes. But then there's the section specifically on nutrition. And again, it's basically one paragraph. It's a long paragraph, but basically just one paragraph out of the whole thing. And what they mentioned was they list that the Mediterranean diet, Paleolithic, low carb, high protein, vegetarian, and nut-enriched diets have all demonstrated benefits on glycemic control and weight loss in people with type 2 diabetes. Then they say the Mediterranean diet producing the greatest improvements in glycemic control. I'm not sure I necessarily agree with that. I guess it depends on which studies you're including. Certainly when you look at some of the non-randomized trials of the very low-carb diets, it's a dramatic improvement and the biggest reduction in diabetes medications. And this brings up an interesting question. What is the goal that we're trying to measure? Is it just A1C or is it A1C with fewer medications? Why is that important? Well, it's important because when we talk about goals of treatment, and they talk about this later in this scientific statement, goals of treatment have traditionally been an A1C of less than 7 or less than 6.5 in younger people. And why not lower? Because there's a higher risk of complications the lower you go. That's in studies using insulin and sulfonylureas, medications that increase your insulin and increase your risk of hypoglycemia. But what would that look like if it was a nutritional intervention that reduced A1C and reduced those medications? And I think that's important because these medications are not benign. We cannot pretend that medications that increase insulin are benign medications because, look, they're great if your blood sugar is out of control. Your A1C is 10, it's 12, and you want to bring it down to 7. Okay, those medications can be helpful. But being more aggressive than that or treating people with lower elevations can actually do more harm than good. And that's an important, very important differentiation. So when we're looking at studies that dramatically reduced medications and those that didn't, there could be a disconnect in terms of the A1C, right? You might be able to get the A1C down lower by keeping the medications higher and having them on a low-carb diet, but that's going to increase the risk of complications. So it makes sense then that you also want to measure reducing medications, especially if it's insulin and sulfonylureas, which can actually increase the risk. So that was a little bit of I don't know, I guess a side diversion for me to bring up because that wasn't included in here. But I think that's important when we're thinking about what are the outcomes. So not just A1C, but also medication reduction, which is really where low-carb diets really shine. Then they also bring up the issue about time, that very low-carb diets are the most effective for A1C control in less than 6 months, but when you go out to 12 months, their demonstrated effectiveness compared to other diets is less. And a lot of this has to do with compliance. A lot of this has to do with the structuring of the studies of adding carbohydrates back. So it does get murky there. But again, this is where you go back to some of the non-randomized trials by Dr. Hallberg and her crew at Virta Health. And what they really show is up to 3 years, very good compliance with a very low-carb ketogenic diet, not, purposely allowing more carbs, and a sustained A1C reduction, which is pretty impressive. And then that's it for nutrition. Now we go into pharmacologic therapy, and this takes up the vast majority of the rest of the paper. Now, there are still some important points to think about here, and they do talk about the difference between sort of old school pharmacologic therapy, being insulin and sulfonylureas, and new school, being the GLP-1 agonists and SGLT2 inhibitors. And the big difference is the GLP-1s and the SGLT2s, they don't increase insulin. And that's important. Insulin and sulfonylureas increase insulin. The GLP-1s and the SGLT2s don't increase insulin. So this is my take on why there's a big difference. I mean, not just mine, lots of other people think this as well. It's not necessarily proven that that's why GLP-1s and SGLT2s have beneficial cardiovascular outcomes associated with them, whereas the insulins and the sulfonylureas don't when you talk about more aggressive treatment. So that certainly could be a big difference. But what's also interesting is SGLTs, SGLT2s, and GLP-1s can also help with weight loss. And SGLT2s basically just help you pee out all your extra glucose and blood. So one other approach would be just don't eat the glucose, don't eat the carbs in the first place, or lose weight by other means while you're still reducing your diabetes medication. So again, low-carb diets can affect with that. High-protein diets can affect with that. So I think the way I would summarize this is, yes, it's great that they're including low-carb and very low-carb diets and they're recognizing them. But for me, the synthesis is finding a way to lose weight in a healthy way that reduces overall insulin, improves your blood sugar, and can do so with the fewest amount of diabetes medications. And so that is lifestyle approach first, which certainly could be a Mediterranean diet, could be even better, a low-carb Mediterranean diet, could be a high-carb diet, and could be a high-protein diet, and could be a very low-carb diet. Any of those approaches are going to work, combined with targeted exercise, with resistance training and cardio training to increase cardiorespiratory fitness, and of course sleep and stress management, other very important things. But this is the lifestyle intervention that we need, not the count your calories, low fat, eat less, move more, and take these medications that raise your insulin. That's the old school approach that really should not have much of a role anymore. So that's my assessment on the scientific update. We can't say that the AHA, the American Heart Association, is really promoting low-carb diets, but at least they're acknowledging it. And hopefully next time, the nutrition section and lifestyle sections will be a little bit longer. Maybe the pharmacologic sections will be a little bit shorter. We'll see. All right, thanks a lot, everybody. We'll see you here next time on Diet Doctor News on YouTube.